A very warm good morning. Welcome and thank you all for joining us today's webinar on women's health through many age brackets, presented by Rupani Foundation USA. I'm your host, Dilshat Meghani, Community Outreach Coordinator at RFUSA. We are going to welcome you all. We are just waiting for our doctor to join us. So we are going to get our doctor on board. So thank you for waiting. A national health survey shows that 1 in every 10 American adult women suffer from at least one gynecological condition. To address women's health issues, RFUSA has organized a very informative session with expert guest speaker, Dr. DIPIKA AMBANI, who has been named as a top doctor for 3 consecutive years by Houstonian Magazine and by Houston Top Doctors. I'm trying to get Dr. DIPIKA AMBANI on board. She's just saying that she's having difficulty on logging. So let me try to get her on board. Thank you for waiting. We are just going to formally start within like 5 minutes. We are just waiting for the expert.
Did she ask me to call?
Hello.
Hello, thank you, Dr. AMBANI, for joining us and welcome.
Oh, pleasure. Thank you for having me.
Thank you so much. Let me start formally now. Okay, as I mentioned that Dr. DIPIKA AMBANI, who has been named as a top doctor for 3 consecutive years by Houstonian Magazine and by Houston Top Doctors. Dr. AMBANI will discuss the following topics in depth today. Number 1, teen gynecology. Number 2, heavy cycle and menstrual problems. And number 3, urinary incontinence. Before we get started, I would like to first go over today's webinar agenda with you. First, we will be going over some webinar guidelines to assist you in participating in today's event, followed with a brief introduction to our RF panelists as well as our guest speaker. After the introduction, we will give our guest speaker the opportunity to share her presentation about women's health through one's lifespan with us, while you can actively participate by answering some quick poll questions. At the conclusion of Dr. AMBANI's presentation, there will be time for questions and answers from the attendees. This is where you will be able to ask questions from Dr. AMBANI. General webinar guidelines to follow. Attendees will be muted to ensure clarity for guest speaker and panelists. Please kindly use the chat function at the bottom of your screen for any technical issue you may be experiencing. Have a question, simply use the Q&A box in the control panel on your screen. You may send your questions at any time during the presentation. We will collect these and address them at the end of the webinar. Please take a moment to complete a brief survey at the end of this webinar. Now, I am very excited to introduce today's panelist. Thank you all for joining us today. Let us start with the chairman of Rupani Foundation, Mr. Nasruddin Rupani. Mr. Rupani is the founding chairman of Rupani Foundation around the globe. Rupani Foundation USA supports health, education, and economic development for underprivileged people, create employment and opportunities for the long term. Rupani Foundation targets the prenatal to 6 years age group for implementation of its customized ECD programs. At this time, I would like to introduce today's guest speaker, Dr. DIPIKA AMBANI. Dr. AMBANI earned her medical degree at the Mahatma Gandhi Mission's Medical Group of Hospitals in India. She completed residencies at Topiwala National Medical College at the University of Bombay and at Baylor College of Medicine in Houston, Texas. Board certified in obstetrics and gynecology. Dr. AMBANI's wide range of clinical interest includes general obstetrics, high-risk pregnancies, pregnancy complications by conditions such as high blood pressure, diabetes, or other pre-existing conditions, routine gynecological care, infertility, evaluation, testing and treatment, minimally invasive surgery, ultrasounds, screening and detection of ovarian and endometrial cancer, and fitness. Dietary and nutrition counseling. She has been practicing in Houston since 1996. Dr. AMBANI treats patients between the ages of 12 and 60. She speaks many different languages, including Spanish. Dr. AMBANI provides patients with the highest quality medical and surgical care and working with them to ensure optimum health and wellness. Her practice combines caring, compassion, personal attention with advanced technology, state-of-the-art medical care, and convenient location in Southwest Houston. Her patients feel that they can relate their issues more openly than with a male physician and have all their questions answered empathetically. A resident of River Oaks, Dr. AMBANI has run half and full marathons. Her other leisure activities include fitness and travel. Okay, before I turn it over to the Dr. AMBANI, I would like for you all to answer a quick poll question that's going to be pops up on your Zoom screen. Let me read question for you. It says, at what age should a woman schedule an appointment with a gynecologist? You have 4 options. Age 9 to 12, age 18 to 21, age 30 are all of the above. So I want you to participate in our first poll question. Let me give you a moment to click on your responses. Okay, so almost I got it. You can see the result on your screen. So let me share the result with you. According to this first poll, I have 100% of the participants are agreed with all of the above. Thank you so much for participating in our first poll. Thank you. Okay, I will now turn it over to Dr. AMBANI. Dr. AMBANI, please.
Thank you so much for a wonderful introduction. So I am actually going to be presenting a few cases that we can help common problems that we can help teenage patients, some young women between the ages of 25 and 40, the commonest problem that most women have. And then we'll go on to a later age where a lot of women suffer from urinary incontinence. So let's begin. Um, she gave me a wonderful introduction. Um, uh, so I have been practicing in Houston for a very long time, and OBGYN is my passion. I love taking care of my women, and I hopefully I stay healthy and continue to do that. So let's talk about, and she already asked the question, so when should a teenager actually see a gynecologist? In general, teenagers do not need to see a gynecologist as long as they're doing well, they're growing well, they're active. Having some pain with their periods is absolutely normal, and I'll cover that in my future slides. But if a teenager is having very, very painful cycles to a point where her daily life is affected, if she's having irregular cycles, extremely heavy cycles, she's bleeding between her cycles, then you should seek to see a gynecologist. Also, young girls suffer from a lot of premenstrual syndrome, and that is a lot of mood changes. They're angry, they have outbursts of anger, they're emotional, they have mood disturbances, they feel depressed or very, very anxious, to a point where it limits their daily life and restricts their daily life. Then you should seek a gynecologist. If they have delayed puberty, say that you don't see any signs of cycles or they're not growing like they should, then by the age of 18, then you should go ahead and seek a consultation with a gynecologist. Acne is a common problem, but if it's affecting their confidence and it is to a point where it's painful, you have to see a gynecologist, because all these things that they face have good treatments, and they can feel better by seeking treatment and consultation and evaluation. Also, sometimes vaginal itching, discharge, repeated urinary tract infections, and if they start being sexually active. So I'm going to cover a few. There are many things that can affect a teenager, but these, I've listed some of the most commonest ones. And so acne, a lot of teenagers suffer from acne, painful periods, irregular periods, and endometriosis. So we'll cover a few of them because we have this 1 hour, and I think these are the commonest ones. So let me talk something about acne. So generally, young girls develop acne, some more than the others, because of course, it depends on their hormones and how their hormones are. Some have a lot of hormones in their body. Some have more testosterone in their body. And so some have more glands on their skin. And so depending on that, and also it's a lot to do with your personal hygiene. Acne forms because there are glands on the skin, and the sebaceous glands on the skin can get blocked. The secretions can accumulate inside, dead skin can accumulate inside, and the pores get blocked, and so you can have bad acne. So having a very good skincare regimen, cleansing your skin really well, using good cleansers, soft cleansers like Cetaphil, Neutrogena ones, they don't have to be really super expensive. But teaching a teenager to cleanse her skin well every day, following a skin routine is very, very important to prevent acne. You can't change the hormones at that stage. So doing skincare is important. Moisturize, but remember, buying a moisturizer which is oil-free is very important if you have oily moisturizers. So a lot of young girls start using oils and coconut oil and things like that, but that blocks the spores and causes more acne to form. And so you have to have a moisturizer that is oil-free. Always use sunscreen when you're going out in the sun. Eating healthy, exercising daily is a very, very important part. If you're doing all these things and your acne is not improving, then you should see a gynecologist. You can see a dermatologist as well. And They will be able to give you medications. Sometimes we give you birth control pills. Sometimes there are other medications like spironolactone that we prescribe, which helps control the acne. And so you don't want your teenager to suffer from lack of confidence because they have acne. Also, if you take care of acne initially in the beginning, then you don't get bad scars and you don't have to worry about scars because you're not getting any acne. Acne scars can be very difficult to treat. Going on to the next one is menstrual pain. So menstrual pain, having some form of menstrual pain is absolutely normal. It is actually considered a normal sign, a sign that your hormones are working very well. It is okay to give pain medications, use some heating pads, take nice warm showers, massage the area, eating very healthy, avoiding a lot of caffeine, chocolates, salt, drinking lots of water and hydrating. These are some important things. So having some headaches, some nausea, vomiting, pain, feeling a little mood changes, these are normal. When do you know that these signs are not normal? When there is a very severe pelvic discomfort that is not relieved with pain medications. And generally when a teenager is having pain, you want to give them about 600 milligrams of ibuprofen. That works really well controlling menstrual cramps, and it has to be given every 6 to 8 hours as needed after food. And if that's not controlling the pain, then there's something wrong and you need to seek help with a gynecologist. Also, if the cramps last for longer than the period of the cycle, which is usually about 5 days. When you see the gynecologist, again, they usually prescribe you birth control pills, and it is not harmful to take birth control pills if you're having these severe symptoms. They will be doing an evaluation. They'll do blood work. They'll check your hormones. They'll check thyroid hormones. Basically, most importantly, they may do an ultrasound to see they don't have any cysts or they're not suffering from some polycystic ovarian syndrome. So an ultrasound will be done, blood work will be done, hemoglobin will be checked to see how badly she's bleeding and if she's anemic from heavy bleeding. And then most commonly, birth control pills help to reduce the pain with the periods and help to reduce the flow of the periods if they don't find any other abnormality that they need to correct, which is thyroid dysfunctions. It's not wrong to take birth control pills. It does not cause long-term infertility, which is a big misnomer among a lot of people. Next, we'll cover irregular cycles. So a cycle would be considered irregular if it has a fluctuation, if they come less than 20 days, 21 days, or if they're coming more than 35 days. That means there's a hormonal imbalance. So your fluctuating hormones is one of the commonest reasons. Some people are on some medications as well that can cause irregular cycles. If your teenager is eating too much or losing a lot of weight because she's worried about gaining weight, drastic changes in the weight can cause menstrual irregularities. Working out too much, poor nutrition, some other drug use, severe stress, and eating disorders. These are the common causes of irregular cycles in a teenager. Again, if your teenager is suffering from these symptoms, then you have to, of course, start having them on a good diet, change things that you can change, get an evaluation with a gynecologist, blood work is done, hormones are checked, and ultrasound may be done. Lifestyle modifications will be introduced. The answer to a lot of these problems is birth control pills because they control your hormones. The current birth control hormones are very low dosage. They don't cause a lot of side effects. Headaches, breast tenderness are the commonest. They do not cause weight gain as long as you eat well and hydrate well. Endometriosis is another common problem. Now, endometriosis is a medical term. It basically means that the tissue that you form inside the uterus is formed outside the uterus. It is formed around the ovary, it is formed around the uterus, and it has no way to exit the body like the menstrual blood. And so all this blood starts accumulating in the body, and it can form large cysts, which are called endometriomas or endometriosis. They can cause severe pain, and they can also cause infertility. You know that this could be a possibility when you have severe pain with the cycles, which is not relieved with pain medications. And the most important thing is see a gynecologist, get an ultrasound done. It's diagnosed with ultrasound. Sometimes we choose to do laparoscopies to confirm the diagnosis in severe cases where we find big cysts. The cysts need to be removed, and then you always have to be on suppression hormones because these are caused by hormones in the body, and you have to be on birth control pills to control this condition. So moving on to our from the younger population to our middle-aged people between the ages of 25 to say 45, most commonly women suffer from very, very heavy cycles. So how would you quantify a heavy cycle? If I say it's 80 ml per cycle, you wouldn't know what 80 ml, how do you count 80 ml? So if a woman is soaking pads, using large maxi pads, which are just soaking through, staining your clothes, bleeding for more than 7 days, passing large clots, or having severe weakness and tiredness because of the bleeding, then that is classified as heavy bleeding. You do not have to suffer heavy bleeding. This is not normal, and there could be something wrong that can be very easily corrected. Fibroids, polyps, a lot of people present to us really late when the fibroids are really large, and if they're caught early, they can be treated in a much easier way. Fibroids are large tumors. They are benign tumors. They're not cancerous, but they're fibrous, heavy tumors that form on the uterus and cause heavy bleeding. Polyps are vascular tumors that also cause bleeding problems. Adenomyosis is when the uterus itself gets really enlarged and abnormally enlarged. Hyperplasia, where there's a lot of lining growing in the uterus because of hormonal changes, and sometimes cancer. Thyroid dysfunction, diabetes, obesity, polycystic ovarian syndrome, and coagulopathy. You will hear a lot of polycystic ovarian syndrome, and that's basically, again, hormonal changes in your body, a lot of estrogen in the body. Women have two hormones, estrogen and progesterone. So when there's a lot of estrogen in the body and no progesterone, tiny cysts form in the ovaries, and they cause more hormonal imbalance, causing you to have irregular and heavy cycles. The other causes can be IUD. IUD is intrauterine device, or a lot of people know it as copper IUD or copper T, which is used for birth control, but that can cause heavy periods. And anticoagulants, that means aspirins and blood thinners, could also cause heavy cycles. So most importantly, if you know that you're bleeding heavy, you want to take iron supplements, you want to replenish the iron, the body loss, the blood loss from the body. Iron supplements help your body to form more hemoglobin, and that helps to raise your red blood cell count. So important to take iron supplements. You should also eat a diet that is very rich in iron food, which is spinach, bananas, dates, green leafy vegetables. All of that are very rich in iron. Also, commonly, a doctor may prescribe birth control pills to control the heavy cycles. They also have hormonal injections, and there are some implants that are inserted in the skin that can help give hormones and control the heavy cycle. Obviously, an evaluation has to be done as to the cause, blood work, ultrasound, sometimes MRIs need to be ordered, hysteroscopy, which is actually looking inside the uterus and seeing if there's a polyp or a fibroid. Those are some of the evaluations that a doctor does to find out what the cause is for the heavy bleeding and accordingly treat it. There are also other IUDs. They're called progesterone IUDs, which are the opposite of copper IUDs. They actually have hormones, and when they are inserted in the uterus, they can help to reduce the heavy cycles to almost where people have no cycles. It serves as a birth control, and it also serves at reducing your heavy periods. There are other medications that can be prescribed. They're called antifibrinolytic and antiprostaglandin medications. Those can be given to reduce the heavy cycles. NSAIDs include ibuprofen, Tylenol, pain medications, where people have heavy cramping with their periods. Also, if you find large tumors, large fibroids, large polyps, There are minor procedures like hysteroscopy that can be done. Now, hysteroscopy is basically we put a little scope or like a laparoscope that's inserted inside the uterus. It is a minor procedure. It can be done in the office under sedation. And if there's a small polyp or cells, bad cells that can be scraped out, small fibroids that can be removed from inside the uterine cavity can be done through a hysteroscope. Large fibroids, heavy bleeding, sometimes uncontrolled with medications, injections. They have to, a lot of times patients have to have their hysterectomy done where the doctors used to open up the belly and take the uterus out. You can leave the ovaries behind if you're at a young age, so you continue to get hormones. You do not lose your hormones, and so you don't go through menopause early by having a hysterectomy. By just simple hysterectomy involves removing of the uterus, removing of the fibroids without having changes in your hormones. If a person is desiring to continue having the ability to have children, then the fibroids can be removed by a procedure called myomectomy without having to remove the uterus. Now, I did want to touch on the newer technology, which is also called robotic hysterectomy. Now, we actually use a robot. So I've had this picture to kind of simplify and kind of explain how a robotic hysterectomy is done. Now, why robotic hysterectomies? Because one, they're very, very minimally invasive. They have we can precisely cut where we actually want to cut. So less complications. The healing time is really, really fast because you're not actually cutting the patient's belly. We're making very tiny, small incisions on the patient's abdomen. And so if you look at the slide, the first picture, it's called the patient cot. And the patient lies on that table. We use robot. Once the patient is under anesthesia, we make very tiny incisions. We insert the robot arms in there. And the surgeon sits on a console, which is the second picture on the slide, and uses tiny little instruments to kind of move the arms, which are attached to the patient's cot, and do precise surgery with absolutely no blood loss and precise cutting. There's a 3D vision on the patient's abdomen, and so less chances of complications, no blood loss, fast recovery. Patients having hysterectomies go home the same day or just stay overnight and go home, and their recovery is within 2 weeks. Less pain with the procedure as well. So people don't have to be afraid of getting a hysterectomy because procedures have been really improvised these days. This is how the robot looks like. And I just wanted to put it out there to kind of give you an idea. We have time to go through a video.
Yeah, you can go ahead.
Okay, so I'm going to just play this video. This is a robot room where surgery is done. This is the anesthesia cot. Once the anesthesia uses this, the patient lays down over there, gives anesthesia. Those are the robot arms in the back. This is how they actually look like. And this is a common OR operating room. The surgeon console is right at the back. These are the arms that go into the patient. Not the whole thing, just the tip.
Okay.
Okay. And then that's where the surgeon sits down. And if you look at the top, we can actually see how you can look inside the patient's belly through these. These are the operating arms where we control these arms, and that's how the surgery is controlled. This is where the surgeon is going to look in and see the inside the patient's belly. Okay. All right. So going on to urinary incontinence. So urinary incontinence can happen to actually any women after childbearing. It is most commonly seen in women after the age of 45 to 50. That is because the hormones are actually going away from the body. People have had children, the tissue kind of weakens. Vaginal tissue, the bladder tissue is kept healthy with female hormones. And once those female hormones start going away from the body around the age of 45 to 50 is when you start seeing these symptoms. So if you're having an urgency to go to the bathroom where you can make it to the bathroom and you leak urine, if you cough, sneeze, laugh, jump, you leak urine. Some patients with diabetes have or other nerve disorders can have their nerves very weak because of diabetes, and nerves are the ones that control the bladder. So weakening of those nerves because of diabetes can cause what is called functional or overflow incontinence, where the nerves don't control the bladder to tighten it, and they just cause spasms in the bladder, causing a patient to leak urine. So yes, needing to rush to the bathroom or losing urine uncontrolled with exercise, laughing, other activities, you can absolutely go seek a consultation with a gynecologist. And there's lots of evaluations that can be done to see what kind of incontinence you have. Diabetes is checked. After an examination, you can find out whether your tissues are weak because of hormones or they are damaged because of childbirth. And then depending on the evaluation, a lot of modifications and treatments can be suggested. So diet modifications means you do not drink a lot of water after 10 p.m. because you don't want to get up in the night and pee. You want to finish drinking your water early on during the day. Hydrate well. By leaking urine doesn't mean that you shouldn't be drinking water. If you don't drink water, you're going to have a urinary tract infection. There are also other wonderful methods. They're called bladder training. And so you maintain a diary where you go every hour, and then you increase the hours and you go pee at certain times so that you're not accumulating urine and you're going at certain times. So it's called bladder training, and we go through the bladder training with you if we find that it's just an issue of a few hormones causing weakening of your tissues. Pelvic muscle could have been damaged by childbirth, and so strengthening the pelvic floor muscles, Kegel exercises are commonly known by a lot of people. A lot of people don't know actually how to do good Kegel exercises. Basically, you tighten up your pelvic floor muscles as if you want to go to a bathroom, but you don't have the right time or the right space to go in. So you're tightening up to hold urine. That's the way you actually do a Kegel exercises. But there are a lot of methods, and I will go over in detail about EMSELA, which is one of the newer treatments that are available to help strengthen the pelvic floor muscles. And those are wonderful technologies that can be done to help you with balancing your pelvic floor muscles and preventing incontinence. If there are nerve issues, overflow incontinence, or diabetes-related urinary problems, then they can be treated with medications. Surgery is one of the last alternatives where you tighten up the pelvic floor muscles with surgery. Surgeries can have complications. That's why they should be the last resort. So this is one of the newer technologies. It is called EMSELA. It's an FDA-approved treatment for urinary incontinence for strengthening the pelvic floor muscles. This is a chair. The patient actually sits on the chair, very comfortable, with full clothes on. You don't have to be undressed. They should not be very thick jeans or thick clothes. It can be some thin exercise pants, shorts, a thin maxi would be fine. And so you sit there on the chair in a certain position. We position you where the chair actually provides radio frequency pulses to the pelvic floor muscles and twitches basically the pelvic floor muscles to contract and relax them as if they were working out to strengthen them. Each treatment consists of 30-minute treatment. It should be done twice a week. Within 6 treatments, which is done in 3 weeks, you have wonderful pelvic support, no incontinence, no side effects absolutely from the radio frequency provided. So it's a wonderful technology. If it's available around your area, I would say go ahead with this. Every lady who undergoes childbirth and has damage to the pelvic floor muscle should have this done right after childbirth. So this is just a diagram showing how your pelvic floor muscles work and how radio frequency is provided to these pelvic floor muscles, causing strengthening of the pelvic floor. And that's all for today. So I'm welcoming questions or anything that anyone would like to ask. You can also go through my website. It's drambani.com, and I have listed a lot of stuff that people can read and get a lot of information. Thank you.
Thank you. Thank you so much, Dr. Ambani, for that very valuable information, including an amazing video about the clinical procedure. I really like it.
Thank you.
We will now open the floor for all your questions. Please ask your all questions using the Q&A button and refer your questions to both panelists and attendees. So that will be visible for everyone. Any question we do not get time to answer will be followed up on our social media platform. So we have enough time, I can see it. So you can ask me more questions you want. We have received so many questions and still they are coming here. So in the chat box and the Q&A box, so I'm going to read our first questions from Sophia. She asks, how to choose a gynecologist for your teen? Can you recommend our aunt how to choose the right gynecologist for me or my daughter? Dr. Ambani, please, can you look at this question?
Yes. So yeah, I would suggest that look up gynecologists that are closer to your area. You want to make sure that they spend time with you, listen to what your complaints are. They're compassionate. They understand where you come from and your background as well, and individualize your treatment to you and not a general treatment. Also, they are sensitive to, there are people who don't like to take some medications or they have religious beliefs on certain medications. They are sensitive to your religious beliefs as well. They should be well educated. They should have good experience.
Oh, thank you. Thank you for a very interesting and detailed answer. Let me process our second question asked by Pooja. So what can I expect when transitioning into menopause for mental health? Can you just elaborate her question, please?
Absolutely. So when you're going through menopause and you also go through a few years of what is called premenopausal age. Now, in the premenopausal age can start anywhere for a person from 39 years of age to about until menopause hits. For a lot of Asian people, the menopause can come early and the normal age can be between 45 to 50, whereas for Caucasians, it can be anywhere from 50 to 52. And so few years before menopause actually hits, you can have a lot of mood changes, weight gain, hair fall, hot flushes. Finally, when the periods stop, it's 6 months. If you have no periods, you can do a hormone test and find out that you're in menopause. Now, mental health like mood changes, anxiety, depression, can't sleep, lack of concentration, those are some of the things that you can face. Eating healthy, exercising are the most important things to do in the beginning when you don't want to take medications. By eating healthy, I mean eating clean. You do not want to eat fried foods, heavy foods, junk foods. You want to eat clean fruits, vegetables, keep a low-calorie diet, rich in protein, low in carbohydrates and fats, and exercise for 30 minutes every day. In the beginning, that will really help you. It is okay to take some medications to sleep. A lot of people take melanin at that age to sleep, melatonin, and that's fine. It's available over the counter. You can also take some Benadryl once in a while to sleep and relax. Staying stress-free, finding good activities to do to relieve your stress, having a me time where you relieve your stress is very, very important. If you've done these basic things and yet you feel like your symptoms are bad, then I would say it is okay to be on hormones and take some hormones to help you out.
Great. Thank you, doctor, for the detailed answer. And thank you, Pooja, for your question. We hope this will help. Our next question is anonymous, and someone is wondering about what is the best time to actively try to have a child? Please have a look at it.
Yes. So I would say generally it really depends. You have to be mentally ready to have a child. Having a child is a huge, huge responsibility, and you want to do it well, and you want to do it to the best of your ability. So you want to be mentally ready for it. It's not necessary that your mother-in-law is ready, your father-in-law is ready, or your husband is ready. You have to be ready for having a child. It is your body that you're going to have the child. It is you who's going to breastfeed the child, and you're going to be primarily responsible more than the dad. So be ready for it mentally. As far as age is concerned, generally it's preferred that a person has at least one child before the age of 35. Now, the reason behind that is because as you age, your eggs, your ovulation and your egg quality, and those start going down, and you have more chances of difficulty getting pregnant after the age of 35. It's not impossible, but it's just difficult. You have more chances of miscarriage, and also the chances of genetic abnormalities increase above the age of 35. Now, if you're studying and you're settling down and you have a career and you want to finish, there are a lot of people who go in for like egg freezing these days, and they can also freeze the egg and store it so that when they're younger, so that if they want to conceive and have a child at the age of 40 after they're done with the career, it's an option. But that should be a last option. If you have other things available, let's say you have a stable partner, you're getting married, try to have one child before 35. If you can have both your children before 35, that's awesome.
Oh, thank you so much. And thank you for the responses to so many amazing questions. And let's ask another one. When should I be concerned about a heavy period? Though you already discussed about that, so she's again asking that, can you just elaborate this one for her so she can get more?
Absolutely. So I see a lot of women in my practice that have suffered for years and years with heavy period. They're anemic, and they seek treatment only when they have become severely anemic. They've had a blood transfusion and they feel weak throughout their life. And so if you're soaking a pad in a day, that is a maxi pad, you're using tampons and your clothes are kind of staining through those pads, then that is called a heavy period. If you're bleeding for more than 7 days, you're passing large clots, then that's qualified as a heavy period. Also, if you start feeling very weak, you can't walk, and you limit your activity, and people know, okay, now you're on your period because you're going to sit down in your room and you're not able to do anything because you're bleeding so heavy, then you have to seek medical treatment. And again, there are such good treatments available out there. There are options, so you can choose from the options, but do not suffer for years and years with heavy period. If you have to use more than, say, 5 pads a day, which are fully soaked, you can qualify that as a heavy period.
Okay, thank you. We value all your questions. Let's ask a few more questions from Dr. AMBANI. Someone is asking about what is the best treatment for urinary incontinence. Though again, you discuss about that, so they are just thinking about the best treatment. So they're just maybe specific treatment.
Yes. So I would say prevention is the best treatment. So do Kegel exercises. If you have had a child, start doing Kegel exercises. Do not gain too much weight with your pregnancies. In general, don't gain too much weight. Exercise, eat healthy. If you've had a difficult delivery and you've had some wear and tears on your pelvic area, see if you have MSLA treatment available around your area, which will strengthen the pelvic floor muscles. Do that. Get evaluated for diabetes and neurological disorders early on, so prevention can be done. Controlling diabetes will help you not get urinary incontinence. Urinary incontinence, basically, you have to classify it as whether you have stress incontinence or you're overflowing the urine. And then depending on the cause, you have to do the treatment. The less invasive it is, the better.
Okay. Thank you so much, Joe. I got a mother, she's asking about that. She has a 3 years old child, 3.5, and she's 36 years old. And she got pregnant after like 3.5 years, and she got 3 months pregnancy and she got miscarriage. So now she's trying to get pregnant. So she's not getting it. It's hard for her. So is it possible? Or she's just asking there. So how can you just tell us about the process?
Yes. So yes, miscarriages can happen. A lot of times it's not necessary that the miscarriages will happen again. You have to be in touch with the gynecologist. You have to make sure your hormones are good, your uterus is good, your cycles are regular. And, a lot of, really speaking, there are 50% of the pregnancies actually do not go through and land up in miscarriages. Everyone does not come and tell you that they had a miscarriage. So it is common to have miscarriages, but do not give up. Have the hope. If you really want a baby, keep trying until you're successful. But be in touch with the gynecologist so that they can help you in the right way.
Okay, thank you. One more question. Someone is asking about the cyst. They have cyst in their ovary, in the right ovary. So she's asking about that. Should I be worried or trying to conceive? So can I get it, or can I not? So she's trying with the cyst. So is it possible to get pregnant with a cyst, or it's going to be like dangerous? So she's asking for that.
Yes, so it is possible to get pregnant with a cyst. Cysts are of two types. They are benign and they can be problematic cysts. So cysts that are generally smaller than 4 centimeters in size, and they have clear fluid, which is evaluated by an ultrasound. And as long as their cancer is ruled out, then they should not be causing any problems. Cysts that are large, more than 5 centimeters in size, they have to be evaluated even more thoroughly. And you need to rule out cancers, you need to rule out other benign tumors of the ovary, which is dermoid cyst. Dermoid cyst will never go away by itself. You have to get it removed. There are some other benign ovarian tumors like cystadenomas, which look like cysts. Those have to be removed. So you have to get it evaluated by an ultrasound. If they're increasing in size and getting larger and larger every time, you have to get them removed. Less than, as I said, less than 4 centimeters, it's okay as long as your cycles are regular, your hormones are good, your thyroid functions are good. You can go ahead and conceive and they shouldn't cause any problems.
Oh, thank you so much. I got many questions. They are very related and you already mentioned in your presentation, but still someone is asking about that. When should be concerned about blood clot in my period?
So if you're passing 3 to 4 large blood clots, as I said, it's then a few blood clots, 1 or 2 blood clots in the whole period, those are fine. But you're passing clots where you're actually sitting in the toilet and you're passing clots that are very large and painful, then you should be concerned. 1 or 2 are perfectly okay, it's fine.
Okay, thank you. This will be our last question for Dr. Ambani. Someone is asking about what age should women start preparing for menopause? Though you already discussed, but still someone wants the detailed answer.
Yes. So menopause, I would say once you reach your 40s, between the 40s, 45s is when you actually start seeing changes. Most people realize when they start gaining weight and they're doing absolutely the same thing. And so that's the first thing that hits. So as soon as you reach your 40s, start eating healthy, look at exercising. That should happen lifelong though. But at 40s, you should be more precautious and, you start thinking about menopause and taking your calcium, taking your vitamin D, taking your multivitamins, exercising, stress relieving techniques, and diet. Those are the most important things you have to start looking at.
Thank you so much, Dr. Ambani. That concludes our Q&A portion of this webinar. If we were unable to ask your questions, please feel free to contact us on our social media platforms for more information. Again, thank you everyone for taking time out to join us in today's webinar. I hope you all are benefiting immensely from our online webinars. As we mentioned earlier, that our webinars are being recorded and will be available on our social media platforms for reconsulting and reviewing. Now, I would like to thank our other panelists and our special guest speaker, Dr. DIPIKA AMBANI, for making today's event more attractive and useful. Through her expertise, vast range of experience, and understanding of women's health, and to meet the individual health needs of every woman walks through the door. We ask that you all stay connected with us for the updates, and let me ask you one question here. Do you currently have a gynecologist? Or do you need to find a gynecologist? If yes, please contact us at Rupani Foundation USA for more information and type an email to dmeghani@rupanifoundationusa.org or by contacting Dr. Ambani at www.drambani.com. You can also do this by liking and following us on Facebook, Instagram, Twitter, and our YouTube channel. Remember to watch our upcoming webinar on July 7th with the well-known psychiatrist, Dr. Aisha Sanubar Chachar from AKU, with another most demanding topic of the current situation related to early childhood development. Once again, thank you all for your consideration and for your great participation. Have a wonderful day ahead. Thank you, Dr. Ambani, once again.
Thank you. Thank you very much.
Thank you. Take care. Bye.